mobile phones and applications to help monitor patients after they get discharged. And we've basically approached it in a very unique way because it reaches a lot of people that don't just have smartphones. It uses SMS technology. It also, so there's some cool stuff that I'll share for later, but we're here to talk about this, which is going to be fun. Maybe before I start, it'd be kind of nice to know just a smidge about, just like name where you guys are from, just so I get an idea.
Yeah. So you get from me, I'm
Yes.
Claudia, and
Nice to meet you,
with Seton Family Hospitals, and I work with teams, nurses, to change their processes and their.
I'm Emma. I'm with the California Healthcare Foundation, and our mission is to improve the health and wellness of Californians, and especially my group focuses on the underserved, so patients that are low income, don't speak English as a first language, and are often overlooked in the healthcare system.
Hi Ryan, I'm a medical group administrator for the Antelope Valley, which is in northern LA County, and I have about 750 employees, about 150 doctors, and readmission is a key topic, so I'm really excited to hear about this.
Great.
And I'm Jenny Cunha. I'm a frontline manager at Kaiser Permanente, frontline manager, and then also I manage IT-related projects, and I'm also an improvement performance advisor.
I'm Mary Katica. I'm a designer with Kaiser. We have an internal innovation group.
Garfield.
Huh?
Garfield?
We're like cousins of Garfield Center. We're all under the innovation branch.
No kidding.
We do a lot of projects there, though.
Bad joke. It's really nice to meet you all. And so part of this is going to be interactive because I really want to hear what you think the future of communication is going to look like and such. I'm going to have some nice green screens that go through and we can have a little discussion together. But I think the first thing to talk about is like what's actually wrong with this slide. I will actually give you a quick hint. It's bright. It's bright. Besides being bright, there's only a few bright slides. Is that, when it comes to a patient and their healthcare, the doctor isn't at the center anymore, right? And I think everyone here knows that. And it's actually, what is the future of how the health system interacts with an individual patient? Because the reality of things is that the patient is over here, and depending on what system you have a general practitioner who you have to get to know, and you have the, according to the PA, the nurse. If you start visiting specialists, you start to meet and interact with more people. And so it starts to become more important of how the patient talks to each one of these members, plus how these members talk to each other. And that just begins to grow as you start to see more specialists. The lab reports you get back from the lab is a form of communication. I think if you guys are familiar with the Wired study that reinvented what these lab reports are looking like that's an example. It's like a lab technician who comes out with these numbers. It has to be in a meaningful way that the patient understands. And so I just have a whole bunch of other different kinds of people that you may run across, a patient may run across in their time in the health system. And communication within all of them is incredibly valuable and important. Something to also bring up as we go through this talk as well too is that all situations are unique. When you come in for general health, you're meeting with a doctor one-on-one. The doctor needs to know your family history. They need to know where you come from. Is it for, you're coming in for the flu or just for a shot or just, for another issue. Chronic conditions. Communication in that instance starts changing because it's not just about a quick, here's a pill and take it. We have to change your life and change your habits. And so when we talk about the future, things start to change there. Also in emergency situations, when a patient comes into the ER, what do you know about them? How does that communication happen, especially when a patient can't talk? If they're really, really severe, or if they can talk, how do you find out more about them, their patient history, all the stuff that the GP knows, how do you get that into the equation? And then I have two others, which are, for outpatient procedures, when you go and you actually make a scheduled appointment, you visit the doctor, sometimes a relationship is built there. And so every situation is unique, and I think it's important to remember that when we talk about all the new technologies and tools that we have going forward. Which leads me to the first question that we can talk about. Just in your opinion, what happens when communication's better? Like when there is better communication? Like what do you tend to find?
More complaints.
Complaints?
Compliance.
Oh, I was like, because that's not a bad thing either. Okay, if it is complaints, it's one of those things that people are more willing to talk about what things they see are issues in the system, but more compliance.
I think when the communication is clear and complete, you don't call all the time. It seems like you're busier if you don't get the complete communication. You need to keep coming back to keep on asking the same question because the communication.
It was cut down on revisits to your physician or to the hospital or wherever it is if you don't understand or.
As a patient, you just have more faith.
Yes.
More confidence.
Trust.
Yeah,
trust is huge.
Care.
Yeah.
I'd say fewer missed opportunities. So for the patient, that's probably like a one-stop shop, one visit that can handle 5 things. Convenience factor would go right through the roof. If you're really able to get better communication, you can. If you have the facility to do it, you can treat a patient across 3 complaints. If you're able to solicit from them what those 3 complaints might be. One of them might be why they're there today, but they may not have been screened for STIs lately, or they may not. They may need some other routine preventative care that you can tackle at the same time that they came in for something that is actively bothering them for some illness.
Exactly. And so that kind of leads to, because those are all the good things that happen, but what's broken today about that from the worlds that you're from? Let's start actually.
A lot. I mean, at Kaiser, it's great that you can email your doctor,
but it's a huge leap from before when you had to call and reach. So.
That's a highlight, I would say, but I think, even as a Kaiser member and also Kaiser employee, I go in and I have the same conversation with the lab technician, I have the same conversation with the nurse assistant or someone who's checking me in, medical assistant, and then I have the same conversation with the MD, so it's just like, okay, I just have 3 conversations, who did I tell what? Did I tell all of them the same thing?
Yeah.
Go ahead.
Oh, no, go ahead.
I think also what's broken today is if you have something wrong, you have to make an appointment and go see your doctor. And is that always necessary? And also when you do see your doctor, you may only have like a 15-minute time with him, and very little of that time is really spent with him, so you're not getting the communication you need that one-on-one.
I think just the access, I think it's, at least where I live, it's very hard to have quality physicians everywhere. I need to go very far to get the type of care that I believe I need, and it's very timing. And so it's very timing for me to be there. And when I get there, it's the waiting time. You need to wait. You need to make an appointment. There is one clinic that works very well oiled. The other one, nobody talks to each other. So it's always, a good thing is I'm from healthcare, so I know how to tie all the loose ends. But I know how many errors, that might occur there because they just don't put everything together.
Yeah, exactly. And actually, I made a list of a few just to kind of go through, and I think a lot of these will resonate pretty well. And so one of them is not enough time, right? Like, doctors sometimes don't have enough time. Like you said, in 15 minutes, that's all they have time to spend, and sometimes that isn't even spent with a doctor, just 5 minutes is. And so that tends to be a big hurdle. So how do we maximize patient and doctor interaction? And sometimes that may come from possibly more information up front for the doctor, but then still, the time thing comes into play. I think another big one is communication's not always measurable, right? Like if a doctor spends more time with one patient and spends less time with another, there's no metric for that. They're not paid more to spend more time in pieces. A little to the repetition, repeating. A lot of groups and a lot of places and hospitals are disconnected silos. There are some institutions that are like Kaiser, which at least they share the medical records across the board and you can at least access them, but some don't, especially when you go between specialists.
But still, workflows are still disjointed too.
I've heard, I think that we did an interview with one of the nurses. She goes, well, for one workflow I can use the computer, but for the other workflow I got to use a fax. And the other workflow I got to use a call. And so
they're very disjointed.
I mean, I'm working on a performance improvement project right now. It's all about communication. It's how can we communicate to the patient about what they need to do prior to their surgery. They hear one thing from the lab, another thing from the OR, another thing from perioperative services, and then we find out that we don't even know ourselves what the one and only workflow should be, and so we got to straighten that up so we can straighten out the communication.
And the thing about that one too is if a patient isn't compliant to one of those instructions, the surgery may have to reschedule, right?
And so that's huge.
Or they're confused about it. Because they're getting it from so many different
people. And then think about
the trust.
That's a big piece. The patients, they won't have confidence. I mean, who wants to have surgery when you call in and someone tells you this thing and then they say no this and
but the silence is scary.
That one you just said there kind of leads to the next piece, like no accountable party. Perhaps in the whole situation, the only accountable party is the patient, right? They're the one who has to deal with this health condition, and possibly the family too, if they're willing and able to help. But in the system, there tends not to be one person that's looking over the entire patient's care, because if there was, there'd be that one point person you could always talk to, but that doesn't exist in many places. Some patient hurdles, too many phone numbers, which one am I supposed to call? Which one am I supposed to call when this happens? Too much waiting, right? You wait for your appointments, you wait while you're inside the doctor's office, for the appointment to happen, you wait to get your lab results, and so sometimes like speed of communication ends up becoming really important. I like this one because the first part is like too much data. A lot of advancements in medical technology sometimes makes more higher fidelity images, right? Like you can see the best CT scans in the world, and some of that's too much data when we're not actually collecting enough granular data. And so it's like, how does this person's life change day by day? And sometimes some of the technology we're doing spends too much time gathering high quality data without, the granularity of like over time. And so that piece is like that. You kind of answered this one in some way of like what the perfect communication's like, but like what do you think the future looks like? Like what is the ideal future? I mentioned for you, like remote healthcare is an important piece.
I think remote healthcare would be a huge piece for me. And just have a clear and complete communication for instance, right now, for 2 weeks I've been waiting for somebody from the doctor's office to call me back.
Yeah.
I know that I need a lab work, and that's not getting across to the physician. So I don't know what's going to take. I think it's going to take me to go visit, but I'm going to have to visit after the lab work anyhow. That's just my routine once a year. And just those things. So the future will be just to have that clear communication that I should not even be the one to be calling them to remind them, hey, it's time for my lab work. That should come from them. Say, hey, it's time for your lab. Go showing of this. So I think just the convenience. And using the electronics and telemedicine and internet and just going there when you truly need to be seen.
Yeah.
I think the future looks like if I have a problem now, that I get it solved now, at my time, when it's convenient for me, get all the answers, and go away with whatever it is I need quickly without waiting, and understanding what I need to do next.
Yeah.
I mean, without all the other stuff in there.
It's the future, like the perfect future, very patient-centered.
And then getting the perfect amount of information at the time that you're hungry for it is key too.
Yeah, because for some patients, if they want to hear everything, some patients just want to hear, so customized as well too, tailored just for you.
Yeah. But not 2 weeks from now.
Yes, no, it's like right. Yeah, and time also leads to stress as well too, so it's like as soon as possible. So what I'm going to do is I'm going to take you into the future. We're going to first jump 10 years into the future to 2020, and I'll show you some ideas of things that we've, in the office talked about as what it could look like. Then we'll jump even 10 more years to 2030, and then I'll take you back to now, to a lot of the companies today that are kind of like paving the way to what the future could be like.